Bismillahirrahmanirrahim. In this video, we are going to study case scenarios related to mediators of inflammation along with their pathologic basis and clinical relevance. So, a 25-year-old man with a known peanut allergy accidentally consumes peanut butter. Within minutes, he developed generalized trachea, hypotension, and difficulty in breathing. So the pathologic basis for this condition is degranulation of the mast cell that release histamine and serotonin that lead to vasodilation, increased vascular permeability, and bronchoconstriction. The clinical relevance of this case is that this is a case of anaphylaxis due to release of histamine and vasoactive amine, and epinephrine is administered to counteract vasodilation and bronchoconstriction. Antihistamines and corticosteroids, they also provide beneficial relief. Then a 60-year-old diabetic patient develops fever, tachycardia, and hypotension after a UTI. Blood culture reveals E. coli presence. The case is of sepsis and overproduction of tumor necrotic factor alpha. The lipopolysaccharide triggered macrophages to release tumor necrotic factor alpha, interleukin 1 and interleukin 6 that lead to systemic inflammation, activation of endothelial cells and septic shock. Early antibiotic fluids, TNF inhibitors in experimental setting help to mitigate this inflammatory damage. In this scenario, a 50-year-old patient with COVID-19 develops worsening hypoxia, fever, and multi-organ dysfunction. The case is of cytokine storm that happened in COVID-19 due to excessive release of interleukin 6, interleukin 1 and TNF alpha. The increased cytokine is due to hyperactivation of macrophages and immune cells in COVID-19 that leads to severe inflammation, vascular leakage and ERDS. So for these cytokine storms, interleukin 6 inhibitors or blockers were used, and there is some activity of corticosteroid in the control or suppression of the cytokine storm. A 12-year-old boy with asthma experiences wheezing and shortness of breath after exposure to dust. The case is asthma and as a result associated leukotriene secretion. Leukotriene B4, C4 and D4, they promote bronchoconstriction, secretion of the mucus and eosinophilic inflammation. And these inhibitors such as montelukast are effective in preventing asthma exacerbation. A 45-year-old woman present with swollen painful joint and morning stiffness that lasts more than 1 hour. The case is of rheumatoid arthritis and secretion of prostaglandin. The macrophages releases TNF alpha and interleukin 1 that lead to COX-2 activation and formation of prostaglandin E2 that mediates pain and inflammation. Non-steroidal anti-inflammatory drugs, they inhibit COX, and infliximab that inhibit TNF reduces the inflammation and joint destruction. A 5-year-old boy presents with recurrent bacterial and fungal infections. His neutrophil failed to produce reactive oxygen species in a nitroblue tetrazolium test. This is a case of chronic granulomatous disease with deficiencies of a reactive oxygen species. So there is deficiency of NADPH oxidase that is responsible for the production of reactive oxygen species, and due to this deficiency there is impaired killing of the microbe. So in this condition there is use of lifelong prophylactic antibiotic and gamma interferon therapy to manage the repeated infections. In this scenario, a 30-year-old man present with a recurrent episode of facial and laryngeal swelling. No trichia is seen. So this may be C1 inhibitor deficiency due to excessive kallikrein activation, and due to this excessive kallikrein activation there is increased bradykinin which induces vasodilation and vascular permeability. This is a case of hereditary angioedema, and C1 inhibitor replacement therapy or bradykinin receptor antagonist are used to prevent the attack. A 22-year-old college student presents with recurrent episode of Neisseria meningitis. So this is a case of complement deficiency and Neisseria infection. Membrane attack complex formation deficiency this impairs bacterial lysis, and these patients are now susceptible to the encapsulated bacteria. So prophylactic vaccine and prophylactic antibodies are crucial for the protection of this condition. A 10-year-old child presents with disseminated Mycobacterium tuberculosis infection. The case is of Mycobacterium tuberculosis and interferon deficiency. So macrophage require gamma interferon for activation and to kill intracellular pathogen. Interferon deficiency lead to ineffective granuloma formation and uncontrolled bacterial spread. So gamma interferon therapy may improve immune function in the affected individuals. In this scenario, a 55-year-old man with hypertension and diabetes develops chest pain and undergoes coronary angiography revealing plaque formation. This is a case of atherosclerosis and chronic inflammation, and this chronic inflammation that is mediated by interleukin 1 and TNF along with oxidative stress promote dysfunction of the endothelium, recruitment of the monocyte, and deposition of the lipid that forms atherosclerotic plaque. So this inflammation is reduced by statin that also decreases the risk of cardiovascular disease by decreasing TNF alpha and interleukin 6 level. Thank you for watching this video. If you have any question, please write in the comment box. Thanks.